Every year, Americans pay an average of $22,000 in health insurance premiums. $22,000. And when the moment finally comes, when you actually need that insurance, 1 in 6 claims gets denied. Not because the treatment wasn't necessary, not because the doctor made a mistake, not because you did anything wrong, because of who your insurance company is. The company you chose, or more likely, the company your employer chose for you, determines whether your claim gets paid more than almost any other factor, more than your diagnosis, more than your treatment plan, more than your doctor's recommendation. Today, we are going to rank them. Every major health insurance company operating in the United States, from the worst at paying claims to the best, using publicly available federal data, state insurance commissioner reports, and the actual denial rate numbers they are required by law to disclose. Some of what you're about to see is going to make you very angry. Stay for the end, because the last thing I show you is the one number that changes everything about how you deal with your insurance company starting tomorrow. Before we get to the rankings, I need to explain exactly how we built this list, because this is not an opinion. This is not a guess. Every number in this video comes from 3 specific sources. Source 1, the Centers for Medicare and Medicaid Services, CMS, which publishes annual data on claim denial rates for every insurer participating in the federal marketplace. Source 2, the National Association of Insurance Commissioners, the NAIC, which compiles complaint ratios for every licensed insurance company in America. The complaint ratio measures how many formal complaints an insurer receives per 10,000 policyholders. Higher ratio means more people had to file formal complaints to get their claims handled. Source 3, the American Medical Association's annual health insurer rating card, which surveys decisions across the country on how often insurers deny, delay, or modify their treatment recommendations. We are ranking on 3 criteria. 1, claim denial rate, the percentage of submitted claims that company denies on first submission. 2, complaint ratio, how many policyholders filed formal complaints with state regulators. 3, appeals overturn rate, of the denials that get appealed, how many does the company reverse? A high overturn rate means they were wrong the first time a lot. The results are not what most people expect. Starting at the bottom, the insurers with the highest denial rates, the highest complaint ratios, and the practices that have generated the most federal scrutiny. Number 1 worst, UnitedHealthcare. UnitedHealthcare is the largest health insurer in the United States by revenue. In 2023, they generated over $370 billion in revenue. They also posted one of the highest claims denial rates in the industry. Their federal marketplace denial rate sits at approximately 32%. That means nearly 1 in 3 claims submitted to UnitedHealthcare is denied on first review. In 2023, a Senate investigation found that UnitedHealthcare's subsidiary NaviHealth used an algorithm called NH-Predict to automatically deny post-acute care claims for Medicare Advantage patients. The algorithm had a reported error rate of 90%, meaning 9 out of 10 of the claims that denied should have been paid. A class action lawsuit filed in 2023 alleged that UnitedHealthcare used this AI system specifically because they knew most patients would not appeal. They were right. Only 1% of denied patients appealed. 1%. The insurance companies are counting on your silence. They are counting on the fact that the appeals process feels complicated and time-consuming, and that most people assume the insurance company's decision is final. It's not final. Number 2 worst, Cigna. In 2023, a joint investigation by ProPublica and the Los Angeles Times revealed that Cigna medical reviewers were approving denials of patient claims in batches, sometimes reviewing and rejecting over 1,000 claims per day without opening a single patient file. One Cigna medical director told investigators he spent an average of 1.2 seconds per denial claim. 1.2 seconds. Cigna's denial rate for marketplace plans averages around 28 to 28%. A class action lawsuit filed in California in 2023 alleged that Cigna used a system called PXDX, which automatically cross-referenced diagnosis codes against treatments and denied claims where the codes did not match their internal guidelines, regardless of individual patient circumstances. The company paid $400 million to settle with Department of Justice investigation into overbilling in 2022. Number 3, worst. Anthem, now known as 11th Health. Anthem operates Blue Cross Blue Shield plans in multiple states and has one of the highest prior authorization denial rates in the country. Prior authorization is the process where your insurance company requires your doctor to get approval before providing treatment. Anthem denies prior authorization requests at a rate that consistently ranks in the top tier of denials nationally. In 2022, the California Department of Managed Healthcare fined Anthem $2.5 million for improperly denying mental health and substance abuse treatment claims. Their appeals overturn rate is particularly revealing. When patients appeal Anthem's denials, the company reverses its decision approximately 40% of the time, meaning 4 in 10 of their initial denials were wrong. Now, the middle of the ranking. These companies are not the worst, but they are far from clean. Humana. Humana's overall denial rate runs around 18 to 22%, depending on plan type and state. Below UnitedHealthcare and Cigna, but still roughly 1 in 5 claims denied on first submission. Humana has faced repeated scrutiny specifically for their Medicare Advantage plans. In 2023, the Department of Health and Human Services Office of Inspector General found that Humana and other Medicare Advantage insurers denied claims that met Medicare coverage rules at a rate that suggested systematic rather than individual review errors. Their complaint ratio varies significantly by state, which tells you something important. The same company behaves differently depending on how aggressively a state insurance commissioner regulates them. Aetna, now owned by CVS Health. Aetna sits in the middle of this ranking because their numbers tell 2 different stories depending on plan type. For employer-sponsored plans, Aetna's denial rate averages around 15 to 18%, middle of the industry. For individual marketplace plans, the rate climbs to 24 to 27%. The gap between how they treat employer groups versus individual policyholders is one of the most significant in the industry. Employers have leverage, individual policyholders largely do not. Aetna's numbers suggest they know this. In 2020, Aetna paid $145 million to settle allegations that they had improperly denied coverage for autism spectrum disorder treatments for children. Molina Healthcare. Molina primarily serves Medicaid and marketplace populations, lower-income Americans who statistically have less ability to fight denials and less knowledge of their appeal rights. Their denial rate from marketplace plans runs around 20 to 24%. Their complaint ratio is elevated specifically in states with large Medicaid populations. This pattern, higher denial rates for populations least likely to appeal, is not unique to Molina. It appears across the industry. But Molina's numbers are particularly visible because of the populations they serve. Now the insurers who perform measurably better than their competitors. Better is relative. None of these companies are charities, but the data shows real differences. Kaiser Permanente. Kaiser operates differently from every other insurer on this list. They're an integrated system, meaning Kaiser employs the doctors, owns the hospitals, and operates the insurance plan. There is no financial incentive to deny a claim because the money stays within the same system either way. Kaiser's denial rate consistently runs between 5 and 9%, the lowest of any major insurer in the country. Their complaint ratio with state regulators is among the lowest nationally. The limitation is significant. Kaiser only operates in 8 states and Washington, D.C. If you're not in California, Colorado, Georgia, Hawaii, Maryland, Oregon, Virginia, Washington, or D.C., this option is not available to you. Blue Cross Blue Shield varies significantly by state. Blue Cross Blue Shield is not one company. It's 36 independent companies operating under the same name and trademark. Their performance varies enormously depending on which state you're in. Blue Cross Blue Shield of Minnesota and Blue Cross Blue Shield of Michigan consistently post lower denial rates in the 10 to 14% range. Blue Cross Blue Shield of Texas and Blue Cross Blue Shield of Florida run considerably higher, 20 to 26% in some plan categories. If you have BCBS coverage, the most important thing to know is that your plan's performance depends entirely on which state entity holds your policy. The top of the ranking, the companies with the lowest denial rates, lowest complaint ratios, and highest rates of paying claims correctly on first submission. Number 1 best, Kaiser Permanente. Already covered. 5 to 9% denial rate, the lowest in the industry. Integrated model removes the financial incentive to deny a claim. Number 2 best, Healthcare Services Corporation, HCSC. HCSC operates Blue Cross Blue Shield plans in Illinois, Montana, New Mexico, and Texas. Their denial rates in Illinois and Montana specifically run among the lowest in the country, 11 to 13%. They're not well known nationally, but their complaint ratios are consistently low, and their appeals process is faster than most major insurers. Number 3 best, Oscar Health. Oscar is a newer, technology-driven insurer. Their denial rate for marketplace plans runs around 12 to 15%, significantly below the industry average. They're available in limited markets, but where they operate, their member satisfaction scores are among the highest in the industry. The caveat, their network is narrower than traditional insurers. I promised you one number at the beginning of this video that changes everything about how you deal with your insurance company. Here it is. 41%. That is the average rate at which insurance company denials are overturned when patients formally appeal them. 41% of denied claims, when appealed, get reversed. Think about what that means. Nearly half of all denied claims should never have been denied in the first place. The insurance company was wrong. And they knew, because the data is consistent across years and companies, that most patients would not appeal. Less than 1% of denied patients formally appeal their denial. 1%. The insurance companies are counting on your silence. They are counting on the fact that the appeals process feels complicated and time-consuming, and that most people assume the insurance company's decision is final. It is not final. Under the Affordable Care Act, you have the legal right to 2 levels of appeal: an internal appeal with the insurance company and an external appeal with an independent organization that the insurance company cannot influence. External appeal overturn rates run even higher than internal appeals because an independent reviewer is not financially motivated to deny your claim. This is the information they do not put in your policy documents. Here is exactly how to appeal a denied claim, step by step. Step 1. Request the specific reason for denial in writing. Call your insurer the day you receive a denial. Ask for the explanation of benefits, the EOB, which shows exactly how they processed your claim and the specific reason code for the denial. Write down every person you speak to, the date, the time. Step 2. Get a letter of medical necessity from your doctor. The most common reason for denial is that the insurer claims a treatment was not medically necessary. Your doctor disagreed. That is why they ordered it. A formal letter of medical necessity from your treating physician specifically addressing the insurer's denial reason code is the single most powerful document in an appeal. Ask your doctor's office for this letter the same day you receive the denial. Tell them specifically which reason code the insurer used. Most doctors have dealt with this before and know exactly what to write. Step 3. File your internal appeal within the deadline. You typically have 180 days from the date of denial to file an internal appeal. Do not wait. File within 30 days. Your appeal letter needs 4 things: the claim number, the denial reason code, a statement of why the denial is incorrect, and supporting documentation, the letter of medical necessity, your medical records, and any clinical guidelines that support your doctor's recommendation. Step 4. If internal appeal is denied, request external review immediately. External review is conducted by an independent review organization, an IRO, that is completely independent of your insurance company. The insurer cannot influence this review. The IRO makes a binding decision. If they overturn the denial, the insurance company is legally required to pay the claim. Request external review by contacting your state insurance commissioner's office or by going directly to your insurer and requesting the external review process in writing. Step 5. File a complaint with your state insurance commissioner simultaneously. Do not wait for the appeals process to complete before filing a complaint. File it the moment you file your internal appeal. The complaint creates a public regulatory record. Insurance companies respond faster and more carefully when a state regulator is watching. Find your state insurance commissioner at NAIC.org. You may be watching this with a current insurer and wondering what to do with these rankings. Here is the practical application. If you are in open enrollment right now, this ranking matters directly. Kaiser, where available. HCSC, where available. If neither is an option, prioritize plans with lower denial rates over plans with higher premiums. A lower premium means nothing if 1 in 3 of your claims gets denied. If you're stuck with a high denial insurer through your employer, which most Americans are, the ranking tells you something equally important. The companies at the bottom of this list deny more aggressively precisely because they know most people will not appeal. Knowing this should change how you respond to every denial you receive. Every denial is not final. Every denial is a negotiating position. The appeals process is not complicated, it is designed to feel complicated. Those are different things. If you have received a denial in the last 180 days, you likely still have time to appeal it. Do not let the deadline pass. The bottom tier, highest denial rates, UnitedHealthcare, Cigna, Anthem. The middle tier, Humana, Aetna, Molina. The better tier, BCBS, varies by state, Oscar Health. The top tier, lowest denial rates, Kaiser Permanente, HCSC. The number that changes everything. 41% of denials get overturned on appeal. Less than 1% of people appeal. 5 steps to fight a denial. Request denial reason in writing, get letter of medical necessity, file internal appeal within 30 days, request external review if denied again, file state insurance commissioner complaint simultaneously. Do not accept a denial as final. It is not final.